Cystic fibrosis (CF) is a genetic disorder that primarily affects the lungs and digestive system. It leads to the production of thick, sticky mucus that can clog the airways and lead to respiratory and digestive issues. CF is caused by mutations in the CFTR cystic fibrosis transmembrane conductance regulator gene, which regulates the movement of salt and water in and out of cells. This faulty gene causes the body to produce abnormal mucus that can lead to life-threatening complications. Causes of cystic fibrosis. Cystic fibrosis is an inherited condition. To develop CF, the person must inherit 2 copies of the mutated CFTR gene, one from each parent. If someone only inherits one faulty gene, they are considered a carrier but won't show symptoms of the disease. The CFTR gene mutation affects the function of a protein that normally helps move chloride, a component of salt, to the surface of cells. When this process doesn't work properly, it leads to the thick and sticky mucus characteristic of cystic fibrosis. Symptoms of cystic fibrosis. CF symptoms vary depending on the organs affected, but the 2 main systems impacted are the lungs and the digestive system. Symptoms may range from mild to severe and can worsen over time. 1. Respiratory symptoms. Chronic cough, often with thick mucus or sputum. Wheezing, similar to asthma, due to obstructed airways. Frequent lung infections, such as bronchitis or pneumonia. Shortness of breath, caused by airway blockage from thick mucus. Nasal polyps, growths in the nasal passages due to chronic inflammation. Sinus infections, frequent and chronic sinusitis due to blocked sinuses. 2. Digestive symptoms. Poor growth and weight gain. Despite having a good appetite, children with CF may not absorb enough nutrients due to problems with digestion. Frequent, bulky, greasy stools, caused by malabsorption of fat due to a lack of pancreatic enzymes. Intestinal blockages, particularly in newborns. A condition called meconium ileus can occur. Constipation, common in people with CF due to thickened intestinal secretions. 3. Other symptoms. Salty tasting skin, the hallmark of CF, as people with the condition lose more salt through their sweat. Infertility in males. Many males with CF have congenital absence of the vas deferens, which leads to infertility. Osteoporosis, due to chronic malnutrition and inflammation. People with CF may develop weak bones over time. Diagnosis of cystic fibrosis. Newborn screening. In many countries, CF is included in standard newborn screening tests. The blood test measures the level of immunoreactive trypsinogen (IR), which is elevated in CF. Sweat test. This is the most common and definitive test for CF. It measures the amount of salt chloride in a person's sweat. Elevated chloride levels are a sign of CF. Genetic testing. Genetic tests can identify mutations in the CFTR gene to confirm the diagnosis. Pulmonary function tests (PFTs). These tests assess lung function and the extent of airway obstruction. Chest X-rays and CT scans. Imaging studies help evaluate the extent of lung damage or infections. Treatment of cystic fibrosis. While there is no cure for cystic fibrosis, treatment can significantly improve quality of life and increase lifespan. treatment focuses on managing symptoms and preventing complications, primarily by targeting lung function and digestion. 1. Airway clearance techniques. Acts chest physical therapy. CPT techniques such as postural drainage and percussion help loosen mucus in the lungs. High-frequency chest wall oscillation vest therapy. A mechanical vest helps loosen and clear mucus. Positive expiratory pressure PEG breathing devices that help keep the airways open and clear mucus. 2. Medications. Bronchodilators help open airways and make breathing easier. Mucolytics, such as Bornase alpha pulmozyme, thin mucus and make it easier to cough up. Antibiotics. Both oral and inhaled antibiotics, e.g., tobramycin, are used to treat and prevent lung infections. CFTR modulators. These newer drugs, such as ivacaftor and elexacaftor/takaftor/ivacaftor trikafta, target the underlying genetic defect in the CFTR protein and can significantly improve symptoms and lung function. Anti-inflammatory medications, such as ibuprofen or corticosteroids, to reduce lung inflammation. 3. Pancreatic enzyme replacement. Since people with CF often can't produce enough pancreatic enzymes, enzyme supplements are taken with meals to help digest food and absorb nutrients. 4. Nutritional support. A high-calorie, high-fat diet is essential for people with CF, along with supplements of fat-soluble vitamins A, D, E, and K to prevent malnutrition. Salt supplements may be required, especially in hot climates or during exercise, due to excess salt loss in sweat. 5. Lung transplant. In cases of advanced lung disease, a lung transplant may be considered. This can significantly improve survival and quality of life for those with end-stage CF lung disease. Complications of cystic fibrosis. Chronic respiratory infections. Frequent infections can damage the lungs over time, leading to respiratory failure. Bronchiectasis. Permanent widening of the airways due to chronic inflammation and infection. Pneumothorax. A lung collapse can occur when air leaks into the space between the lung and chest wall. Diabetes. CF-related diabetes is common, as the pancreas can be damaged over time. Liver disease. Blocked bile ducts can lead to liver damage, including cirrhosis. CF-related infertility. Almost all men with CF are infertile, and some women may experience reduced fertility. Prognosis and life expectancy. In the past, CF was often fatal in childhood, but advancements in treatment have significantly improved life expectancy. Today, many people with CF live into their 40s or beyond. Early diagnosis, new treatments like CFTR modulators, and better management of infections and nutrition have contributed to this improvement. Living with cystic fibrosis. Managing CF is a daily challenge that involves airway clearance, medications, and careful attention to nutrition. Regular monitoring and follow-ups with a specialized CF care team are essential. Support groups and mental health services can also play a critical role in coping with the emotional and psychological aspects of living with a chronic condition. Conclusion. Cystic fibrosis is a serious, lifelong condition that primarily affects the lungs and digestive system. While there is no cure, advances in treatment, particularly the development of CFTR modulators, have dramatically improved the quality of life and life expectancy for people with CF. Early diagnosis, individualized treatment plans, and regular medical care are key to managing symptoms and preventing complications.